I'm Carole Taylor. On this edition of Journal, Healthcare. Now, how can we ever have a meaningful discussion on how to improve healthcare delivery in Canada when we aren't even allowed to ask the question? Medicare is perfect, until it isn't. Tangentially, this reminds me of the President Biden situation when all of his spokespeople were insisting he was in perfect health, until the public saw with their own eyes during the debate that in fact something was very wrong. So what are we seeing with our own eyes about healthcare delivery? Well, all 7 OB-GYNY doctors, the entire unit, resigned their positions in the Kamloops hospital, citing unsafe working conditions and staff shortages. People in Kelowna were told in the spring that the entire pediatric team at Kelowna General Hospital was being closed down due to poor working conditions. And last year, British Columbia started sending some of our cancer patients to Bellingham in the United States because we couldn't guarantee timely delivery. And of course, our headlines are filled with ER closures around the province, Merritt, Mission, Delta, and on and on. I can't imagine the family that showed up in the middle of the night with a sick child only to find the ER closed thinks our healthcare system is just fine. And I haven't even mentioned wait lists and the shortage of family physicians. One man who has been warning of this impending crisis since 1995 is Dr. Brian Day. He has devoted years, 13 of them in court, fighting provincial and federal governments trying to be heard. Brian has recently written a book, My Fight for Canadian Healthcare, and he joins us after this message. And this is Dr. Brian Day's new book, and it's just an amazing journey, this book. I don't know how long it took you, but everything is documented. And I want to ask you a really major question, which is, do you think that Medicare can survive?
I believe in Medicare. You know, I believe in a health system looks after the lowest socioeconomic groups in society, but Medicare as we have it isn't doing that, and so it shouldn't survive as it is. It needs, it needs change. And my approach has always been, look at other jurisdictions in the world that are outperforming you, just like you would if you were running a soccer or a hockey team. Look at what the top 2 or 3 are doing, and learn from them and introduce some of their policies. But we aren't doing that. We're just sticking with the same old attempt to maintain maintaining the status quo, basically.
So let's look at that status quo, because some people think, okay, these are the truths about Medicare, and others say these are the myths about Medicare. So let's start with Canada has the best healthcare system in the whole world.
Well, I don't think anyone now believes that. Every single study has shown where, yes, if the best means one of the biggest spenders, well, after we're in the top 3, so yes, we're spending a lot on healthcare, but in terms of performance, we're down outside we're down at 29, 30, 31st in the world, and that's not good enough.
And the other one is, well, no one ever dies on a waiting list.
Well, a group called Second Street Org just came out with a study saying at least 28,000 Canadians die each year on wait lists, and that's probably an underestimate. And we know from doctor surveys, 26% of all doctors have had a patient die on a wait list. So that's simply not true.
And you brought up some of those numbers, of course, in your court case.
Yes, and I referenced them in the book. One of the things I did in the book was to make sure I put in a source for every statement pretty well that I make, and of course it's got some of my opinions too. But I think it's important to be able to go to the source and look, is this actually a fact? And that's why I put in a lot of references.
Did you have some of your witnesses who were involved with you in the case that eventually went up to the top, but who died while your case was going through?
Yes, we had two two patients. One was an elderly woman who died while waiting for the trial to start, and similarly, the other was a patient who had cancer and died while waiting for the case.
You tell many stories throughout the book. One that really struck home for me was a mother whose two daughters ended up dying on the waiting list, waiting for care.
Yes. And, you know, I'd say if these were just case reports, I think every society probably has that happen because, you know, medicine is not an exact science, and sometimes you can't predict how serious an illness is. But when 28,000 Canadians die on wait lists every year, and most importantly, you know, that's why we had our lawsuit there, it's legal for them to do anything about it. That you are forced onto that wait list. In other words, the governments across the country are forcing patients to die on wait lists, and unless they leave their own place of residence. And you know, there was one interesting story that I talk about briefly in the book is an Italian law expert from Rome wrote an article on Canada's health system, a 14-page article in an Italian journal, and his conclusion was Canada's health system is designed for wealthier people who can afford to leave their home when they need health care. That was his conclusion.
So it's a system for the elites because they can get away.
The exact opposite of what people arguing in its favor claim it to be. And Stats Canada, the Canadian Information for Health Information, has come out with data to show that the lowest income groups in Canada have the worst access and the worst health outcomes.
And so another myth truth is that everyone in Canada is treated equally and gets the same opportunities at care.
Well, you and I both know that. I mean, you're a recovering politician. You know that certainly if you're the Premier or a Minister of Health or an MP federally or an MLA locally, you don't wait. But most interestingly, there are all these exempt groups like federal employees. What I kind of joke about is that prisoners and policemen, federal policemen, are both exempt and can both access private laws. And I said, one of the things we were fighting for in our legal action was that people who are not in should have the same rights as those who are in jail. But we lost.
You place it throughout the book, these wonderful cartoons. And one of them was about that. There was a prisoner sitting beside another guy, and he said, well, I need knee surgery, so I got arrested. I'm in jail. Now I'll get the knee surgery, and then in 2 years I'll be out, and it'll be sooner than if I'd gone on the wait list.
Yeah. But I mean, the sad thing is I'm not saying people go to jail for that, but that is a sad reality in terms of what would happen. Yeah.
I don't think people generally in the public think about all the exceptions there are, like workers' compensation. They get service whenever they need it, as fast as they need it. What do you do about that?
Well, perhaps more astoundingly, if you like, is the fact that, we went to court and asking, I wanted our lawyers to look the judge in the eye and said, my lord, this is us asking you to grant ordinary citizens in this country the same legal rights you have to access private health care. Because I've treated judges at our clinic and been funded privately by the federal government. And
in fact, you do say quite openly in the book that some of the loudest voices that stood up against you and against this 13-year case were people that have taken advantage of private clinics.
Yeah, I say openly in the book, I don't name them, but I was hoping I'd be cross-examined, but the interveners wouldn't cross-examine me, so then I could have named them. But we've had two leaders of the NDP who've had private treatment at our clinic and paid for it. That's why, in 1999, the Vancouver Sun, I wrote an article called "A Hypocritical Oath." And that's what
a
they
good
take.
use of words.
Yeah.
And so they stand before you and they criticize you and then they come for help.
Yes, yeah. And that's, we've had people, a group called Canadian Doctors for Medicare, protesting outside of our clinic with placards and being interviewed by the media and microphones stuffed in their mouth. Of the 15 people, 2 of them had private surgery and paid for it at our clinic.
And so you've got a code of ethics that you're not going to say who the patients are or were.
Right. One of the things that was of interest is that if those groups some of them I mentioned, had cross-examined me on the stand when I was on the stand, our lawyer could have said to me, "Please name those people," and you have to respond. So that's the reality of the law. Like the only time you are forced to reveal patient identities is in a court of law if you're asked. And but I mean, I don't need to be asked their names, but just those are the types of persons. One of the things I point out too is our system is loosely based on the Canada Health Act of 1984. Both Pierre Trudeau and Monique Béjean, who brought in that act, went for private surgery operated on privately by a friend of mine after the Canada Health Act, a friend of mine in Ottawa.
Okay, we have more stories to tell, and we'll be back in just a moment. Stories always bring things to life, whether it's facts or quirks. We've got some real quirks in our system that I don't think people are aware of, but one story you tell is of a mother whose son had cancer of the leg. So the surgery was done, the leg amputated. But then
the prosthesis, to allow that child to walk again, is not covered by the government health plan in British Columbia, and on this arbitrary, weird statement that it's not considered medically necessary to have to be able to walk, and this is
how can this be going on in our healthcare system? I mean, what does that mother do if she can't afford it?
She has to pay for it, or one of the quirks too is we talk about how private health insurance is banned in Canada. Well, one of the interesting things is 70% of Canadians have private health insurance, and it's to cover these so-called not medically necessary services. And the ridiculous definitions of not medically necessary include an artificial limb if you lose. The operation I talk about was a hindquarter amputation in a child. The whole, not just the leg, but the whole half of the part of the pelvis is removed for cancer. The limb to allow that child to walk again is not covered. But neither are, in Canada, neither are prescription drugs or ambulances or dentistry. We might think, oh, dentistry, but you have an abscess in a wisdom tooth, it can penetrate through to the brain. And to say that's not an important medically necessary issue is ludicrous. And
the voice box you mentioned.
I mean, I had a patient receive a letter from the BC ministry. They'd had cancer of the larynx or voice generating part of our throat, and in order to talk again, this person needed a device called a voice box, an electronic device. And he applied to the government to get this and received a letter saying that the government body, the Medical Services Plan, has decided that a voice is not medically necessary. This is how ludicrous and arbitrary our system is, and it has to change. And one of the other things, to say that we have equality, as we pointed out earlier, is ridiculous because 30% of Canadians don't have that insurance. And one of the things that people attack as my approach to this for is, private healthcare is for the rich and wealthy. Well, no, I've worked in Switzerland. I've been to Australia and the Netherlands. And in those countries, So in Switzerland, for instance, where I was there for 6 months working as a junior doctor, the government, the system is mostly private. Like the hospitals are mostly private, the insurance is mostly private. What the government does is for low income groups, it pays the premiums. So if we introduce private insurance and private healthcare into Canada, the solution to, oh, this is for the rich and wealthy, is to do what the Swiss do. And that is, for those that can't afford the premiums, the government pays them, rather than creating this massive bureaucracy. You know, one of the things I point out in the book is the story of a German colleague who visited me last year. And I jokingly, I knew the answer, but I said to him, you know, in Germany, you have a 90% public system and 10% private. You know, in the public system, how long does a patient is, you know, suffering in pain wait for a hip or knee replacement? And his answer was, oh, it's a long time. It's a long time. I said, he said, compared to the private system, it's way longer. I said, well, how long is it? He says, oh, could be 3 or 4 weeks. And he said, it's only 1 week or so in the private system.
And what would it be here?
It would be a couple of years by the time you went to see the surgeon and then had the procedure. And and of course, one of the things I relate that to is that we have this massive bureaucracy in Canada, and we have 14 ministries of health for a population of about 44 million. And, you know, countries like France and Germany with 2 or 3 times the population have one person, one ministry. But we have 14. Each of them has deputy ministers and associate deputy ministers and so on and so on. So Germany, for every public health bureaucrat that they have, Canada has 11. And these individuals, you know, they're not being poorly paid. They're tax-funded jobs. And BC alone has 64 vice presidents of hospital regions. Well, you know, I kind of joke, how come we need 64 vice presidents? I mean, even the United States gets by with 1. And it's each of those individuals being paid probably $500,000 a year or more of taxpayer funding.
Another weird thing is that if I needed surgery, I'm not allowed to go to a private clinic in BC, but I can just go over to Alberta and go there.
Yes.
And the reverse.
So to show you how ludicrous our system is, a few months ago, I was operating on 5 British Columbians at our clinic. Sorry, 5 Albertans at our clinic. And a colleague in Alberta was operating on 6 British Columbians. So this is bizarre.
So people are just doing the switch.
Traveling. But as I say, low-income groups can't afford to do that. You know, this goes back to what I said about the Italian journal writer, that we have this system which is nonsensical in many ways. Now, a solution. So years ago, there was an individual called Thea Vakil, who was the Associate Deputy Minister of Health in the NDP government at the time. And at a forum, open forum, I said to her, I said, wouldn't it make sense, you know, we see thousands of British Columbians go down to the United States for healthcare. You know, across the country, it's about 300,000 Canadians or more who do that. But thousands of British Columbians go down to the United States for healthcare. Wouldn't it be better if they stayed here? They're going for private healthcare in the States. They could get it done more cheaply. It would be jobs would be created here. We wouldn't be rationing our hospital. Public hospitals could do that care for a fee. And what this Associate Deputy Minister Thea Vakil said, well, if I could stop them at the border, I would. In other words, this is like the United States was building a wall to keep Mexicans out. This would be building a wall to keep Canadians in. And it shows you the attitude of some in the bureaucracy and some in government to the freedom. Because To me, this is about freedom, that an individual should not be illegal to care for oneself or one's loved ones in times of need.
So it seems to me like we've really hit a crisis. I know that word's overused, but it's almost as if Medicare is crumbling from the inside out when I looked at all the examples of the areas that it's falling apart. Is this the time that something might happen?
Well, one of the things I'm often asked, and I actually talk about this, is what we blame. We can blame politicians, or we can blame the courts. But sometimes we have to look at ourselves and say, maybe we're to blame. And there's an old song that a fellow called Donovan sang. It was written by Buffy St. Marie, a Canadian, called "The Universal Soldier," and it points out, it's about war and who causes war, and it's not the soldiers, it's not the governments that send them to war, it's the people that elect the government, and we've got to take some blame for for the mess we're in.
That's a note for all of us to remember. Thank you, Brian, so much. This book is amazing reading. It's a journey on our healthcare system. Back in a moment. As a sign of the changing times, Premier Danielle Smith is proposing to bring some flexibility to Alberta's healthcare system by introducing a hybrid model that allows doctors to work in both the private and public healthcare systems at the same time. She believes waitlist times would be cut while public health care would be protected. Dr. Brian Day calls this a good first step. Let me know your thoughts on YouTube. Till next time, I'm Carole Taylor.